time, I'd like to call the meeting to order. To call your attention to the agenda, second page, where it says approval of the CEO contract extension. It should say approval of the CEO evaluation. So note so amended. At this time, we'd like to welcome James Beaker as our new trustee. I have a oath I need to read. Do you want us to stand?
Probably.
Oh. This is the oath of office. I, James Beaker, do solemnly swear that I will support the Constitution of the United States and the Constitution of the State of Iowa, and that I will faithfully and impartially, to the best of my ability, discharge all the duties of the Office of Trustee of Myrtue Medical Center in Harlan, Iowa, as now or hereafter required by law.
I do.
Okay. Welcome. On approval of board committee assignments, those were sent out. Ruth, yes?
Yep.
Surely will, yep.
Okay, I don't remember seeing them.
They were in the packet.
Oh, in the packet. They were in your packet. Are there any changes that anyone would like to make? I need a motion on the approval of those committee assignments, please.
So moved.
Thank you, Jim. Second from Terry. All in favor?
Aye.
All right, I am hereby done with my responsibilities and hand them off to Mike Frederick. Ready?
Thank you. Yeah, not really, but yeah. All right. Barry's going to go through the annual conflict of interest disclosure statement that we just got handed out.
Yeah, so we just need to have you, we do those once a year. Have you turn those back into Ruth when you have a chance to look through that and get that signed off. And then so I got a couple things here. So the annual review of hospital constitution and bylaws, that does need to be reviewed if there are any changes in the last year, and we did look at that. There have not been any changes in the past year, so just need to make you aware of that. And then we are required by our critical access hospital guidelines to have the board approve our, do an annual approval of review of contracts for patient services, which is on pages 4 and 5. So done a listing of those services for contracts for patient services. So that would just need approval from the board on that.
I move approval of contracts for patient services.
I'll second.
All in favor?
Aye.
Opposed? Same sign. Motion carried. Then we got the approval of annual investment portfolio review by Christie.
Okay, this was in your packet also. Okay. So it was in your packet, so just to kind of go through what we have for investments. Right now we have about $16,714,940, including accrued interest in just unrestricted, used for operation, used for capital improvements, those type of things, investments, and that ranges from, we have some mutual funds with New York Life that have a market value of almost $2.7 million. That showed about 11% gain from last year at this point in time. Pretty good. Shelby County State Bank, we have a $500,000 CD. Most of our CDs are in that 5% range, which that one is. Defiant State Bank, we have had $500,000, 4% interest. Farmers Trust and Savings, we have a 5.2% interest on a $500,000 CD. Mid-States is 3.5 million at 5.03% on average. United Bank of Iowa is 2.75 at 4.62. Town and Country is at 1.5 million at 4.36. LPL, we have CDs in various banks through their portfolio is 2 million. 5.2% is the average on those. And we had some treasury notes at the end of the fiscal year, or at the end of the calendar year at 2.5 million for 5.07. Weighted average of those, we're seeing about right now 5.89% return on our investment, which is considerably better than we've been getting for years.
Yes.
For other investments that we have the Health Partners of Southwest Iowa, which is our collaboration with Montgomery County and Cass County Hospital. That value went up 27.74%, our investment in that. Berkshire Hathaway is stock we have on the market, which is went up 15.46% in the last 12 months. Some board designated funds, because we were self-insured for health insurance. We had UBI CD of $500,000, and then our money market account at Shelby County State Bank at $357,000, and that's to fund our health insurance claims and responsibilities there. So overall, at 12/31 of 23, we had 18.9, almost 19 million in investments, earning an average rate of 7%. So, as you can see, we're down a little bit from last year. We are using these CDs to pay for our ER project and using up those reserves rather than funding any kind of debt service. Still much cheaper to do this. Any questions on the investment portfolio?
No, very nice.
All right, can I get an approval to, the approval of the annual investment portfolio review?
I'd make a motion.
I'll second it.
All in favor?
Aye.
Opposed, same sign. Motion carried. Okay, we'll, the approval of the minutes for the December 12th meeting. Can I get a motion on that?
Also move.
Second.
All in favor?
Aye.
Opposed, same sign. Motion carried. Mid-staff meeting summary.
Okay. You probably saw Dr. Anderson snuck in a little earlier, but he has a lot of patients on West, so he asked if I would go ahead and give his report this morning. So medical staff met on January 16th, approved quite a few standing orders. One is for our rapid response team. So basically, if a patient were to have some trouble, these are some orders that nurses can start prior to the doctor arriving, so we can get things started. Also approved for TED hose, so to prevent patients from getting blood clots. Nurses can go ahead and initiate that. Bladder scans, this is a non-invasive way of measuring what's in the bladder, so they approved that nurses could go ahead and do those as well. And then for the outpatient department, we had a new practitioner who wanted to order some allergy injections that could be completed here at Myrtue, and so the medical staff approved all of those standing orders. So we also talked to medical staff about the MRI truck. It is now being housed here at Myrtue, so you might see it sitting out there a little more often than before. And with that, we also have more available appointment times, which is very nice. So we have the truck here for our use on Sundays, Tuesdays, Thursdays, and Fridays. And then again, more available times to use the truck. Kim talked with the medical staff about our new practitioners and our new weekend hours. Saturday, 8 a.m. to 4 p.m., Sunday, 11 a.m. to 3 p.m., and that began on January 20th. So making sure they were all aware of those changes. Jill talked to the medical staff about some new family practice candidates, and we had the architects here and construction managers talking to the medical staff about master facility plans. Any questions? Thank you.
Next, we'll have the quality improvement report by Laura.
Yeah, 12 departments reported at the January 17th system-wide QI meeting. Behavioral health reported on all new measures, evaluating no-show rates, care coordination, and substance abuse documentation, as well as ensuring that patients that haven't been seen within 6 months receive appropriate communication with those patients. Home health reviewed patient satisfaction results and pre- and post-service assessments, kind of looking at what improvements we're seeing from admission to discharge for home health patients. Hospice evaluated that patients were seen in the last 2 to 3 days of life, and the family experienced satisfaction rates, which were excellent. Dietary reviewed adequacy of nutritional support, which was 100%. A1C, kind of looking at that improvement of the diabetic numbers after receiving dietary education. And overall, there was a 2.1% improvement there. And they also monitored proper covering and labeling of food. For lab and blood usage, they evaluated the units of blood transfused and compliance with regulations and proficiency testing. And medical records is really doing a great job at monitoring ED documentation for completeness, OB and surgical assistant coding, and then following up with providers that they have questions, if they have questions regarding that documentation. So they're really doing a great job there. That's all I have.
Okay. Now we'll have the Personnel Committee report by Jim.
The Personnel Committee met this morning at 7 o'clock. We had 16 initial appointments, 7 reappointments, and 3 voluntary withdrawals. I'll make a motion to approve those as presented.
We have a motion to approve. Do we have a second?
Second.
All in favor?
Aye.
Opposed? Same sign. Motion carried. Go to the, looks like we got the CEO evaluation, yeah.
Okay.
Right.
The compensation committee met in December. The committee's made up of Mike, Terry, and myself. And we met with Barry to discuss his evaluation. I'd like to just read the notes if you bear with me. The committee gathered input by surveying the Board of Trustee members. We also reviewed the organizational goals and outcomes of the 2023 goals set by the CEO. The survey and goal discussion gave us a good opportunity to reflect on the work that has been accomplished, plus a look ahead at the 2024 goals. We are pleased to report a positive evaluation of CEO Jacobson today. He is commended for his efforts and his ongoing work to keep Myrtue Medical Center focused on quality, safety, and continuing to provide the value our patients expect. Thank you, Terry. If any of you were interested, there is a long 2-page list of the accomplishments that Barry gave us. I'd be glad to share those with you in the Dropbox or.
That would be fun. Thanks.
Thank you.
I'll make a motion to approve this.
Okay. We have a motion by Janine to approve the CEO evaluation. Do you have a second? Terry seconds. Terry seconds. All in favor?
Aye.
Opposed? Same sign. Motion carried. Then next we'll go to Barry with the CEO report.
The main thing I had to go over was the insurance coverage for 2024. We work with a broker out of Omaha, FNIC, as well as a local agent, Brent Sheevy, with the agency. They kind of partner together on our account. We usually start this process as early as probably October. Christy and I meet with them, and that's really the first step in that process. And they did go out for bid on a lot of our insurance coverage this year. We met with the finance committee and Brent and Jeff Scanlon in late December. Went through it in a lot of detail, answered a lot of questions from those finance committee members. And they did approve moving forward with our coverage for 2024. I did send out that detail to the board, I think, about a month ago. but the total cost for the insurance premiums for 2024 is $647,077. Don't usually go into a lot of detail here at the board meeting. That's why we have the finance committee. And
What's the increase from the year before, can I just ask?
yeah, it was pretty significant. It went from 473,000 to 647,000. So we did have a big increase. We will be working with a different malpractice carrier. One of the other areas where we see kind of a big increase is with the property coverage due to the events that we've had over the last few years, deratios, and everybody's feeling that increase when it comes to property coverage.
From what I hear, it's across the board, though. Consumers are all seeing that increase also.
Yeah.
So pretty big increase this year, but I do would like to have the full board kind of ratify that decision that was made by the finance committee back in December. So if we could get approval for that insurance coverage.
I'll make a motion to approve that.
We have a motion to approve the 2024 insurance coverage. Do we have a second?
Second.
A second. All in favor?
Aye.
Opposed? Same sign. Motion carried.
And then I'd ask Jill to maybe do a quick update on our recruitment efforts, and then after that, maybe Jeff could talk briefly about the ER project.
Sure. So we do continue to have some strong interest in our family medical OB position. We've interviewed 4 physicians in the last few months. Of those 4, we continue to pursue 2. One being a second-year resident who would be available in June of 2025, and the other being a experienced family medicine provider who's been practicing for about 16 years. So we're still in conversations with both. Both have a strong interest in full-scope traditional family medicine. They've interviewed with myself and Dr. Brian Anderson. So we just continue to have conversations with those 2 to make sure this is a good practice fit. And then if we identify that as such, we would invite them in for a site visit to experience Myrtue, the community, meet with our medical staff.
The one with the 16-year experience could start sooner, or is that our goal? I mean, do we have a date that we're trying to complete?
So sooner, ideal. This candidate could start sooner. He's actually a practicing physician in Iowa, very familiar with critical access. Currently is performing a locum function, so would be available anytime within now and August. So, yeah, we are looking at that individual for that reason.
locum functioning?
Temporary traveler.
Okay.
All right, any construction update? Yeah, the emergency department is going very well. You know, the pictures really don't show a whole lot, haven't changed over the last few weeks. However, all the piping, the conduits, the infrastructure has been progressing very well. All of the rooms, except a couple, have sheetrock on one side and insulation. We got an electrical approval last week, so now the installation is being finalized and the sheetrock on the second side is being installed. So it's going very, very well there in the ED. The cafe, we're a little bit behind on it slightly, not very much. However, the floor has been leveled. It looks totally different in there now, and the sheetrock probably was finished on Friday. So then this week they are going to tie in some underground plumbing back into the tunnel for some of the drains that need to be installed. So things are progressing pretty well there. The one thing that is at risk, I guess, is the grease ducting that we need to go up to the roof on that. That has had a long lead time, and so that's where our delay is coming in. And then Thursday or Wednesday, I believe it was, the coffee shop was finished. We were to have an inspection on Thursday, actually happened on Friday, we passed, so all that is ready to open up whenever the coffee girl is ready. So, what questions do you have about construction?
Sounds smooth.
we hope.
Anticipated to be completed?
The cafe right now is May 18th, totally completed. The serving area and the seating area is estimated the last week of April. What's left to do will be some of the hallway work right out in front of the kitchen entrance, in front of the elevator, and the hallway then that would go from there to the west towards maintenance area. The emergency department is August 12th. What is the due date? They're doing very well, but we don't want to say they're ahead of schedule because then we'll be way behind. So, yeah, things are moving very well. Those are the two dates that have been contractually planned.
How's our water softener?
Water softener started Monday. Today's Tuesday, yesterday. So they were in working, they were removing the material inside of the tanks. I didn't get down to see how far they got yesterday, but they'll remove those tanks. The other tanks will be coming in. So hopefully midweek, next week, we, knock on wood, should have that all done also.
Good.
All right, Barry, do you have anything else, Barry?
No, I don't have any others.
Okay, we'll move to Christie with some updates there.
So our policy is to pay the IRS mileage rate to our employees who have to use their own personal vehicles to travel for business purposes. So the 24 IRS rate has gone to 67 cents, and we need to have approval for that. Is that right?
You just tell them.
You don't have to have approved. Oh, okay. Then we do need to have approval of a corporate resolution because the chair and the different positions that sign the check changed. So we do need a bank resolution passed naming Mike and Jan, correct, to sign our checks.
I'll make that motion.
Second. And Ruth, I believe, has the forms for everybody to sign so that we can electronically
Okay,
enter those.
we have a motion and a second. All in favor? Opposed, same sign. Motion carried.
The monthly financial reports in your packet was November and December because we did not have a financial, or did not have a board meeting that we had them available at. So for November, just to kind of do high level here, November we had about 7.6 million in revenues for the month, which is higher than we had last year at 7.6 million for the month of November. Expenses were approximately the same, just a little slightly higher at $4,490,000 and $4,400,000 in November of 2022. So pretty comparable for expenses. Bottom line, net income from all sources for November was $536,000 compared to $457,000 in November of 2022. Go into a little bit more detail here in December, most recent month we have finished. Up on the screen there is the condensed version, which has some statistics in there. Our outpatient visits were at 4,520 for this year. Last year were 4,387. So year to date, we're at 29,015 compared to 27,964 last year at this same 6-month period, which is a 3.8% increase. The ER visits, we had 561 in December this year. Last year we had 498. So we're approximately about the same year-to-date of 2,955 compared to 2,939 last year. So it's just a 0.5% increase. Surgical procedures continue to go up. We had 121 surgical procedures in December of this year. Last year we had 119, 716 for year-to-date. 681 last year. So we're at 5.1% increase in our number of surgical procedures for the first 6 months compared to last year. Physicians clinic visits, we had 3,826 this year. Last year we had 3,555. Year to date for 6 months is 21,705 compared to 21,440. So we've seen a 1.2% increase in our number of visits at the rural health clinics. Behavioral health, we're at 1,233 this year, 1,201 last year, 7,176 year-to-date, 8,000 last year, which is a 10% decline. We've had a lot of staff changes there, so it takes a little bit to build that clientele back up. Average daily census in December was 10.6, which is higher than we've had for several months. We were 10.47 last year. Year-to-date, we're still at 7.89. Average daily census, 9.28. So it's about a 15% decline in our number of inpatients. First, we had 10 in December. Last year we had 7, so we're at 41 compared to 48 for last year, this 6-month time period. 27 for December, we had 4.9 million in operating revenue, 4.4 million or 4.5 million in operating expenses, so $400,000 difference there. We do see a net operating loss there. We've been doing some transition of our investments with New York Life, and so we sold some investments and put it into other investments that have been recommended to us, so that's kind of what hit us the month of December, but as you can see from our investment report, we still are 11% higher than we were last year. So still doing a good rate of return on that. So year-to-date, or excuse me, for December, we had a $400,000 net operating income compared to $138,000 last year. Year-to-date, for the first 6 months, we have $1.3 million in net compared to $961,000 last year, which is a 36% increase. So we've been busy in the month of December. Any questions on our financial reports?
All right, can I get a motion to approve the monthly financial statements?
I'll make a motion to approve.
Motion, can I have a second?
I'll second that.
All in favor? Aye.
Aye.
Opposed, same sign, motion carried. Payroll and claims for December.
I'll make a motion to approve.
I have a motion, can I have a second?
Second.
All in favor?
Aye.
Opposed, same sign, motion carries. And the approval of the publication for public hearing date for tax.
Yeah, so our tax budget, or for our tax asking is due to the county auditor by mid-March, and we have to have a public hearing. So just to kind of go through it, we've been through this with the finance committee also. So we always look at this, and hopefully that's big enough. I tried to shrink it down. The tax asking, so we always take a look at what is our rate compared to other county hospitals in the state of Iowa. We are the 15th lowest rate in the state. I believe we were 14th last year, so we went down one, but we're still at 1.17, so 179, so we are still 15th lowest based on rate. If you look at the tax dollars that are generated from that, we are the 9th lowest in tax dollars that we get into, that we levy, which is, I believe, the same as last year. So from our levy, we generated this current fiscal year $1,156,040. Lowest in the state is $496. Highest is $2-3 million. So I guess they didn't put that on there. But so for our tax comparison, so in Shelby County, what we look at for taxable valuation went up $83 million this year, $83.6 million this year, which allows us to, for the same tax asking, we can lower our rate. So for our general and FICA levy, which we have to do a general levy first, and then you can do an increase in levy, we're going to keep that tax asking for those two levies at the same. So that tax asking will go down 0.085 cents, 8.5 cents, excuse me. The ambulance levy, because of the valuation, we are levying a few more tax dollars there. We have a contract to pay into Shelby County ambulance service now. based on our contract that we have with Medevac. So that does go up slightly, but with the taxable valuation, our rate actually goes down. So the tax dollars for that goes up slightly, the $8,172. So the tax rate altogether from our three levies that we have will go down 9.6 cents. So it will be at $1.08 per thousand. And as I stated, the property tax and utility tax calculated funding last year was $1,156,000. This next year will be $1,164,000. The difference being $8,172, which is our ambulance service additional increase. And that will go down in 2026 financial year because that would change. It's anticipated to at this point in time. So the budgeted, we do a budget internally for operational, but for tax purposes, we also have to do a budget. We generally budget higher, a lot higher than we actually would anticipate doing because you don't want to have to amend budget unless you have to. So it is it's not way out there, but it is a little bit higher than we will do for our operating budget. But so the certified budget revenues are $75,181,000. In budgeted expenses, we budget to continue to maintain our fund balance, so we budget the same for expenses, $75,181,000. So we have to publish that the proposed budget at least 10 days and no more than 20 days prior to our public hearing. So what we're asking for is the board to set the public hearing date for February 27th at 24 at 7 a.m. in the Auble Room here at the hospital. And then that once that public hearing is held, we hear comments from the community. If there are any, the board will approve the budget as published or not, and we will have to file that with the county by the 15th of March. So I guess we just need approval to set the public hearing date.
I'll make a motion to approve the public hearing date of February 27th at 7:30 in the Auble Room.
I'll second Jim's motion. We have a first and second to approve the public hearing dates. All in favor?
Aye.
Opposed, same sign. Motion carried. Now we'll, I believe we're going to go into closed session. We need a roll call to go into closed session.
Let's make a motion to go into closed session.
I'll second Steve's motion. All in favor?
Aye.
Opposed, same sign.
We have to have each person say aye to them.
Jim, aye.
Mike, aye.
Can I?
Janita?
If you're ready.
Yes.
Kate, aye.
Aye. Motion carries. In closed session.